The Catholic Epiphany is the latest dust-up between the federal government and the Catholic Church. Really a preview for all Americans of what they can expect under Obamacare. Here to talk about it is Joe Rago of the Editorial Board. Joe, thanks for being here. So this has been discussed as kind of a Catholic problem that the president has, and it's basically for people who haven't heard yet, this is regulation coming out of the Department of Health and Human Services after the passage of Obamacare, basically telling all kinds of organizations that if you're going to offer insurance to your employees, it has to include contraception and sterilization services. Now, Catholic and other religious groups said, well, how about an exemption for conscience? If religious beliefs dictate that you shouldn't have some of those things, can we not put them in our insurance plans? And the answer so far has been no.
Absolutely not.
Either a religious organization has to serve only people within its own faith and not anyone outside of that, and I guess it basically employ only people within the faith. I'm not sure, or you have to provide these services. And like I said, it's been seen as a Catholic problem, but there's really a larger issue. I mean, some people might say, regardless of whatever you think of who ought to pay for contraception, there's sort of a larger issue here in terms of the role of government.
Right. No, exactly. I think people of all faiths and even no faith are looking at this and going, well, gosh, the Catholic charity down the street can't design their own insurance plan. The soup kitchen around the corner, they're not allowed to decide what they cover, regardless of issues, even of religious conscience, which has special protections, obviously in the First Amendment. And they're kind of looking at this and going, well, hang on a sec. If they're going to beat people up because of their moral convictions, what about my own convictions? Where do I stand in this system? And kind of the entire philosophical and policy apparatus of the Affordable Care Act is about standardizing these decisions, taking them away from individuals, from people's own choices, and sort of arrogating them to the government. So this has been a real teachable moment. You don't have to. Most American women use birth control at some point in their lives. You don't have to agree. It's not really about birth control. It's more about government control and the way they're taking these individuals out of the private sector and putting them, into Kathleen Sebelius's regulatory ministry.
She's the Secretary of Health and Human Services, and I don't know if you would say, you're the expert here, I don't know if you would say it's one of the principal failings of Obamacare, but it brings up this issue where they've had problems in many states of legislators eager to dole out goodies to various interest groups, mandate that this or that has to be covered by insurance.
Right, and most states, if you don't get your insurance through your employer, if you're a small business or an individual buying your own insurance, you're usually laboring under a mandate that you have to cover birth control, just like all kinds of other services. States love to do this.
Right.
The HHS mandate goes well beyond even what states have done. So that's part of what's driving this. But
okay, well, just to clarify this, because I know some people have said that the Catholic organizations and other religious groups should not be freaking out because 28 states already do this. But what you're saying is the guidelines in 28 states are not as far-reaching, and I'm guessing allow some freedom of action for these religious groups to express their conscience in the plans they provide.
Right, exactly. The HHS mandate is very narrowly drawn, so the only way you can get out of it basically is if you're the local parish or the church or whatever, and you're only covering the people who work directly for your church. It's kind of the broader, Catholic hospitals, for instance, things of that nature where they're affiliated, but they have a broader social mission. Those are all the people and the institutions that are getting cracked down here, and it's a measure of HHS's overreach that they sort of had to grab this prize, which even liberal states haven't gone as far. So that's sort of another factor that's underlying the furor here that I don't think anybody really expected.
So we had a lot of these states putting all kinds of mandates on what an insurance plan has to be, raising the cost of insurance in the process. we now have the federal government, I guess, taking that model and making it nationwide, where, I mean, to me, this seems like one of the easy cost containment methods would have been to allow people to buy the plan they want instead of the plan that various politicians designed for them.
Right. I mean, that's really the core of it. It's not just about birth control. It's about all services. I mean, insurance at bottom is just a financial product. It can be as gold-plated as you want. It can be as bare bones as you want. But all those gradations come with a cost, and what you want is people to be able to compare policies and say, well, that meets my needs, that meets my preferences, that meets my value, my moral convictions. Let me choose that one. We don't have that in America right now, and we're actually moving farther away from that towards just kind of the homogeny of whatever they come up with in Washington.
Okay, now beyond the issue of the federal government stomping on my rights as a consumer, or a church or religious organization's rights, or the people who worship there, their rights in terms of freedom of belief, is it a good idea, as you look at insurance markets, is it a good idea to create insurance for everyday expenses that are not hugely expensive? Now, I know we've seen a lot of stories about how, well, it can be a serious expense for people who don't have a lot of money to get birth control, but this is not like the cost of a car accident or your house burning down.
Right. Well, I mean, that just goes back to the trade-offs between costs and benefits. Some people are going to want to stick with the insurance they have today. They should be required to pay for it. Maybe others just want to go to the car insurance model. They want to pay out of pocket, and obviously that would require a lot of structural changes in how we provide health care now. But in a looser, freer market, that's a model that could work. But the point is that you and I are going to have different needs and preferences. The guy filming this is going to have his own needs.
Right.
And what you want in healthcare, which is individual, you want people to pick what works best for them.
Right.
And really, this isn't about birth control. It's about taking the choice away from the three of us and sending it to somebody who's never met us before, but thinks they know what's best for us.
Right. Now, last thing, just in terms of what's likely to happen with this HHS rule, it originally, as proposed, was going to hit, I believe, this fall, then was moved back a year, so now it's sometime in 2013. All of these religious organizations will have to comply, I guess, or face some kind of dilemma about pulling back from various social service missions. Now, I know the government has said it's trying to work out a compromise with religious folks. Any idea on how that's going to work out? I mean, would you expect the Obama administration to ultimately cave at least on this discrete point, or what do you expect?
Well, I mean, I think it depends on whatever President Obama's pollster has to say, to be honest. When HHS came out with this, they said it was a compromise. We've worked this out. We've massaged the differences. That obviously wasn't true based on the public reaction. Yesterday, David Axelrod go on TV. This is the president's chief political advisor, and say, "Oh, well, hang on. Maybe we can look under the hood and change some stuff." But I really think it's going to come down to just is this going to hurt them with swing voters? What about certain states?
The answer is yes. Thanks, Joe.